Before we get started, I just want to say thank you to Nancy Egger, my first Morgellons patient. I had no idea what I was getting myself into. And 65 Morgellon cases down and thousands left to go. You know, I appreciate you for introducing me to this wonderful world. Cindy, thank you for all that you do. Dr. Sabley, thank you for mentoring me and molding me. And for everyone else, Mary Ann, everyone in this community, we work hard for you guys, and we thank you, the patients, for coming year after year and, you know, listening and learning. So this is an experience for all of us. So what I'm going to do today is discuss how to apply functional medicine in the treatment of Morgellons. A lot of this was already reviewed by my colleague. You know, like minds think alike. You know, he's Germany to U.S. We do the same things, but hopefully we'll also learn some new things. Every year I do a case presentation, and you know, what I found is after some of my talks, I have patients who show up like, well, I tried this, and this, and it didn't. I'm like, wait. It's an individualized treatment approach to everyone. Just like with treating tick-borne illness, I don't like to use the term protocol. You know, there are certain regimens that work for certain patients that might not work for others. So I'm going to use this time to just give a general overview of some of the functional medicine approaches that I use in my practice, and which I find useful. However, when you're going through treatment for any chronic debilitating disease, you need to make sure you're following the recommendations under the guidance of a health professional. And I can't stress that enough. I know that with this disease it's challenging. You know, there are not a lot of people out there that you find can help you. But do your research. Go to the Charles E. Holman Foundation. Find someone to help you, because you can do yourself a lot more harm than good with self-prescribing medications. I just want to make sure you understand that. All right, those are my disclosures. You know, hey, I don't have anything to disclose. All right, so what we're going to be doing today is looking at what's called the healing template. And going through the healing template, we're going to talk about how we treat chronic disease, Morgellons, tick-borne illness, and others by looking at neuroendocrine support, which is brain hormone support, gastrointestinal support, detoxification and drainage, elimination of the causative factors, cell healing and repair, and then healthy maintenance. What I find is that a lot of times patients want to jump and get to stage 4. Get me better right now. I'm tired of being sick. Treat me, give me my antibiotics, or I'm going home. I don't take the bullying too well. But I also make sure you understand that there are certain stages. Everybody goes through different stages at different times, all right? But we're going to just go through an overview. I think I'm having issues as well. All right. So when you look at a comprehensive healing strategy, you look at pharmaceuticals, which are prescription drugs, supportive agents, and antimicrobials. You can look at homeopathic agents, which are highly diluted substances that trigger the immune system, herbals, plant-based medicine, and lifestyle, which is important, which can include mechanical intervention, lifestyle changes, and nutrition. But keep in mind, like I said, you need to have a customized approach to treat your needs. Your Morgellons protocol can be completely different from your neighbors. You know, I always tell people, stop comparing notes. What worked for A may not work for B. Now, one of the things that I try to always assess with patients is the status of their hormone system. Women, a lot of time they'll tell me, I have worsening symptoms on my period, or they feel better when they're pregnant, or when I'm going through, you know, menopausal symptoms, I feel worse. I think that anything that can change your body's biological baseline state, and one of which being effects on your adrenals, may that be your sex hormones, thyroid, cortisol levels, can impact how you heal from disease. So some of the tests that I do in my practice, I evaluate their cortisol, which is your stress hormone, Elevated cortisol levels are stressors on the body. So a lot of times, they say stress can kill. Well, if your cortisol level is high all the time and you're sitting around in a fight or flight response all day, well, how is your body really going to recover and heal if you're stressed 24 hours a day? And more importantly, when I'm testing for cortisol levels, I find that patients with chronic diseases, especially my tick-borne illness patients, they tend to have high cortisol levels. Usually you want your cortisol level high in the morning and it goes down throughout the evening. Well, I'll see patients who have very low cortisol and then they're sleeping, cortisol is going up. And that can lead to a chronic non-fracture, non-restorative sleep. You also want to make sure you evaluate some sex hormones. If people are perimenopausal or people have kind of polycystic ovarian syndrome. Some women have high levels of testosterone. Evaluating for thyroid, test for your imbalances, because with thyroid you can also have an autoimmune thyroiditis. It can be an autoimmune phenomenon. Checking for glucose, intolerance, screening for diabetes, screening for glucose intolerance, and vitamin D deficiency, which we see quite a bit in our Lyme disease population, and it can be due to the potential of tick-borne illness and its effect on the endocrine system. But I've also saw that a lot of my patients, that should say vitamin D, not rector, but receptor mutation, VDR mutation. You also want to make sure that patients are sleeping. I don't prescribe sleeping drugs in my practice. I try to find other ways to help patients with sleep, because think about it. If you're not sleeping, your body's not healing. And that goes back to what I said again about cortisol levels being high throughout the evening. But that's just common logic. If you're up all night, how is your body going to reset itself? All right? So your sleep goal is to have uninterrupted sleep and feel refreshed in the morning. So what you have to do is try to evaluate why the person isn't sleeping and try to treat those problems accordingly. Is it a pain issue? Does the person have poor sleep hygiene? Is it associated with their mood? Trying to reduce stressors or improving mood. Do they have sleep apnea? I see that quite a bit of times. Patients, I send them for sleep studies and they have an apnea component that just isn't addressed. And then you hear little things. Oh, wow, I had a great night's sleep, so I feel great today. Yeah, you will. My husband always makes fun of me because I listen to, podcasts from conferences all the time in the car or at home. And he's like, babe, you guys just use all these fancy Latin words to say go to sleep and eat well. That's all you do. I mean, it's true. You also want to make sure, especially in, the Morgellons population, that you have pain control and neuropathy control. So that could be pharmaceutical with, prescription meds over the counter or topical. Carson mentioned earlier about some topical homeopathic agents like arnica. There are also prescription meds, of which Dr. Savely has mentioned in her book. You can do, holistic approach, or even just kind of changing your diet, trying to decrease some of the inflammatory foods that you eat can decrease your pain burden. And then mechanical intervention for pain, acupuncture, physical therapy, exercise, and other forms of alternative strategies for healing, massage therapy, sauna, stretching, chiropractor techniques. Now, stage 2 of healing is digestive support. And in my practice, for a lot of patients, I do prescribe antibiotics, and I find that at the same time that I'm prescribing any type of antibiotic, I need to simultaneously do my best at supporting the gut microbiome, because that's where 60 to 70% of our immune cells are in our GI system. And a lot of times, patients, especially by the time they come on my doorstep, they've seen numerous doctors, and I'm talking about those who've had tick-borne illnesses. and they've been treated with antibiotics for numerous years, and they're more likely to have a predisposition to something called leaky gut. Now, this is just a picture of the gut here, and it's from a Nature magazine article. So in your gut, you have these epithelial cells in the normal gut. So this is your gut, and this is your kind of gut on drugs or on the standard American diet. All right, and here you see these nice tight junctions in these epithelial cells. You have this nice strong mucosal barrier here. You have these immunoglobulins that provide a functional barrier and prevent the pathogens from entering in, and so you have a tolerant immune response. And then over years, due to the foods we eat or antibiotic therapy, other types of toxins, this barrier is impaired. So now the pathogens leak in, and you get a dysregulated immune response, and that can lead to leaky gut. And I don't know if you've even looked on television now. Every other commercial is about stool. Are you constipated? Are you having diarrhea? See little guts running around different everywhere in the doctor's office. Here's a stool. I'm like, wow, we're finally getting it in mainstream medicine. The gut, I feel, is also the second brain. So when I'm treating the gut, I do take a functional medicine approach. So removal, replace, re-inoculate, repair, and rebalance. So removal, that's one thing I do discuss with my patients in general, because a lot of times they'll say, well, I don't feel good, so I'm just going to eat what I want. Well, we're at only stage 2 of healing, so you want to find out what food sensitivities a person has. It may require, depending on the patient's needs, an elimination diet. It may require doing food allergy evaluations. You also want to make sure you evaluate for pathogenic microbes like yeast, bacteria, and parasites in the gut to remove those. And I like to do stool testing, on my patients. One of my patients called me the poop queen, and for Christmas she gave me a pencil with a, stool on top, and, I kind of waved that around because I feel like if you're in my office and you're not having regular bowel movements, or you're bloated, or you're not on probiotics, and, you're eating poor diet, then that's going to really cause you to have difficulty with healing from any type of chronic complex in general. And it's just the ABCs of medicine. So when it comes to replacement, using digestive enzymes or, different hydrochloric acid or prescription enzymes even. Apple cider vinegar is also something over the counter that can help break down your food into smaller particles so that you more effectively feed that good gut bacteria in your microbiome. And re-inoculate. You have probiotics. There's one probiotic I just learned about this weekend from Research Nutritionals, which is soil-based. And you also have plant-based probiotics. Making sure you get a good source. Do your due diligence with probiotics, because not every probiotic is a good probiotic. And then prebiotics. Prebiotics are adding foods, some of the foods listed below, that can help regulate the gut flora, all right? And that can be fermented vegetables, tempeh, natto, fermented raw milk such as kefir or yogurt, all right? And then prebiotic-rich foods like raw chicory root, garlic, leeks. Those are all foods that can help stimulate good gut bacteria and good gut flora. And then you want to repair. All right, so that's using certain antioxidants, like curcumin is a great antioxidant. Not only does it help repair the microbiome, but it's an antioxidant systemically. Krill oil or high-dose fish oils. And then that gut mucosal barrier, things like aloe vera, olive leaf, oregano, bone or mineral broths, and some essential oil blends can be very healing and soothing to the gut. Stage 3 is really looking at decreasing your detoxification or your toxic load, because there's just more than just infections with Lyme or Morgellons at the core of what's going on clinically. When you do have Lyme, it wreaks havoc, and you can have biotoxins and other inflammatory responses that are initiated and can be the center to the illness. So you have to find a way to have that detoxification pathways keep up as you're treating the underlying infectious process. And I like for patients to just kind of understand, and this is a template of your liver detoxification pathways, which is from the textbook of functional medicine. And it gives a good overview of how all of our livers work. So you have endotoxins, which are end products of bacteria, and then you have exotoxins, which are everything we eat, drink, smell, touch, taste. Those toxins enter, and they're what's called lipid soluble, meaning they dissolve in the fat. The goal of removing toxins is to convert those lipid soluble toxins into water soluble. Okay, so you want to convert those fat soluble into water soluble so you clear them out of your urine and out of your stool. And there are two pathways, two phases of pathways that you go through in order for this to occur. Now, the first phase is what's called the Cytochrome P450 enzymes, and that's an area of interest in genetics at this time. These are specific enzymes that are coded for certain toxins in your body, all right, and there are several of them. That means you break those toxins down into smaller particles. Now, what happens is a lot of times you get what's called uncoupling of this detoxification pathway. Either you're breaking the toxins down and you're not clearing them. And so when that happens, you start having those toxins just circulate. And that can lead to free radical damage or secondary tissue damage. Or you can have uncoupling because you're constipated. And so I like to tell patients you become like a cesspool because all those toxins just kind of build up. Or you can have what's called conjugation pathway imbalances. So those fat-soluble toxins don't convert to water-soluble, and that can be due to methylation disturbances or other glucuronidation and other detoxification. We'll talk a little bit in more detail about those imbalances that can occur as well. Other things I like to do for patients is I like to screen them with what's called a Nutri-Eval, which allows for me to check for the levels of all these enzymes and cofactors, including B vitamins and proteins and amino acids, that are needed in order for this detoxification pathway to go on and be processed accordingly. Because we heard earlier about some of the nutrients that can be used as you treat, some of the vitamins that you can include, the B vitamins, D. Well, there are other amino acids, but I like to find out a patient's level or value or how much they might require or what my recommendations may be. Because that's what I mean about trying to specifically tailor a treatment approach based on an individual's need. Because if you think about it, if you're deficient in the vitamins and nutrients that are needed for conjugation, then you will become toxic and you will have that free radical damage. And you won't be able to produce things like glutathione, which are free radical antioxidant, free radical scavengers. Now, one thing that I have started to do in my Morgellons patient population, and even my tick-borne illness patients, is I screen for what's called Mthfr mutations. And that's an area of research that deals with what's called methylation, which is basically, in general, a carbon with 3 hydrogen atoms. It's your body's ability to turn on and off cells. That's just the general nature of it all, okay? It's one small polymorphism in this huge biochemical pathway. When you have methylation disorders, your body is unable to do what's called methylate folic acid and B12, which can lead to cell membrane impairment, problems with DNA synthesis, and an inability to detox. And it can also lead to that phase 1 and phase 2 detoxification impairment. Now, this is, like I said, with MTHFR, it's just one small, what's called polymorphism on this huge structure. And I'm interested in research in nature because of my time at NIH. So genetics, that's like my best friend. And when I'm looking at, chronic complex diseases, I always put on that researcher hat because I want to better understand, well, why does this one patient have this versus someone else who may have had a similar exposure? Do I think that methylation disorders are the answer to all of this? No, but I do think that this is an amazing area of interest and on the horizon in the research, and especially in our community. So just a quick overview of MTHFR, this mutation. It allows for your body to produce SAMe, which is a precursor to all your neurotransmitters. And also you go through this pathway to produce glutathione. Okay, and glutathione is the good guy. It's kind of like a Pac-Man that goes around and clears all the toxins out of your body. All right, that's just kind of a basic overview. I can spend a whole lecture talking about methylation disturbances. In 1995, they had what's called the C677t Mthfr. Most studies only refer to this one because they were finding that patients with that genetic mutation had higher risk of blood clotting. And then you have one called A1-1298 Mthfr, which was started to be published in 2001. There are other defects, all right, and there are a lot, like I said, down the horizon which are being currently researched. Now, the most common C677t is associated with what's called elevated homocysteine. And I see this, I would say, honestly, right now my patient population with Morgellons, about 80% of them have it. They have increased risk in this group with heart disease and the publications and stroke. Also increased risk of DVTs published, what's called peripheral neuropathy. You see in the literature publications with placenta vascular problems or other problems during pregnancy. And then the other mutation that's commonly shown, A1298T, is associated a lot of times with neurotransmitter instability. So you see depression, anxiety, fibromyalgia, chronic fatigue, migraines, nerve pain, dementia, all of those diseases being associated with this enzyme mutation. Or you can have patients who have both, one of each gene, and they can have symptoms of both defects. I see this commonly in my population as well. And the symptoms are more severe, and it can lead to a compromised immune system. Well, you think about it, if this is something you were born with, there's no way any doctor is going to be able to change your genes. And if it's something you were born with and you haven't been sick all of your life, then why is it that you could potentially start having activation of these mutations later in life and start not to feel well? It's just like with anything. Disease is multifactorial. You can have both environmental causes and genetic causes of disease. So a stressor on your body could potentially make that genetic variant more active, thereby causing you to have the symptoms associated with that polymorphism. Now, stage 4 is kind of when you get down to the nitty-gritty. Now, you don't go, like I said, you're not going in this order per se, but I'm just giving you different stages of healing. And this is when you get down to the treatment. Get me well, doc. Find out the elimination of the causative factors. And I look at environment, lifestyle, as well as infections. Now, you got to make sure you evaluate the environment. A lot of times you miss the mark. I've had patients, when I started treating tick-borne illness in 2011, I would just plow antibiotics. Why isn't this person getting better? Oh, yeah, I'm living in a moldy basement. Or, oh, yeah, doc, I had a flood yesterday. Or, oh, I have all these metal amalgams in my mouth, and I test them for mercury, and it's through the roof. And it's like, yes, Dr. Sabley mentioned immune burden. Okay, I'm missing that part. Your immune burden can be hindered by environmental toxins. So I have now started to do my due diligence with all of my patients, making sure I evaluate both their workplace and their home environment. And I'm doing my due diligence with evaluating for mold exposure, heavy metal exposure, diet, water intake, and just other lifestyle toxins. So the most prevalent in the literature research for mold toxicity is by a physician by the name of Richie Shoemaker, who's done a lot of due diligence in looking at the treatment of chronic mold toxins and environmental history. And in his papers, he's had different labs that you can test for biotoxin markers. He's also showed evidence of visual testing, VCS testing on his website, Surviving Mold, that if positive, his literature, his publication shows that it's high indication that a person has had potential mold exposure. Also environmental testing like mold ERMI testing. Screening for multiple antibiotic-resistant coagulase negative staphylococci or MARCons. And then also there are urine mold testing by real-time labs that you can do. Now, it doesn't mean that mold is the potential cause of the symptomology, but it can be an important environmental toxin that can contribute to perpetuation of your current clinical symptom. So it's imperative that you do your due diligence at removing or evaluating that as a potential barrier to getting well because of its ability to cause your immune system to be compromised. And this is Richie Shoemaker's biotoxin illness paradigm. And what he shows is that patients can get biotoxin, and you can't really see it well here, so I'll do my best to go over the details. So he shows that, you know, you can get these biotoxins from the environment, and I've added lime. And then most patients can remove those toxins down this pathway. But other patients, and it may be due to genetic predisposition, and I saw yesterday in Eva Shoppi's work that some of her new data, she's researching what's called HLA-DR, which is a SNP that Richie Shoemaker reports in his work, HLA-DR being associated with some of its variants being associated with mold toxicity, meaning a person's ability to be more susceptible to mold toxins. And even some of the variants can potentially be more susceptible to Lyme toxins, all right? So you have the HLA, and it can cause damage to the part of the brain called the hypothalamus, all right? And that can lead to what's called low MSH. That reduced MSH here, which is another lab marker that stands for melanocyte stimulating hormone. When that's low or less than 35, you can have sleep disturbances, chronic pain, GI issues. You can have a prolonged clinical course because your white blood cells don't recover well. You can have changes in your hormones, including your cortisol level and your sex hormones, as well as what's called antidiuretic hormone, which can lead to frequent urination. You can have that MARCons bacteria that colonizes the nose, which I alluded to earlier, which can also release a biotoxin and can cause symptoms of fatigue, of chronic pain, of headache, and of chronic sinusitis. And you can have inflammatory related symptoms by checking inflammatory markers like what's called TGF-beta 1. When it's elevated, it can be associated with headaches, muscle aches, unstable temperatures, difficulty concentrating, and more. And there are other inflammatory markers, C4A, which is a non-specific inflammatory marker, but in Richie Shoemaker's work, he has shown when it's elevated, can be associated with biotoxin illness, all right? Other markers, BIP and MMP9, those are also associated with biotoxin illness. So those are some initial screening that I do for most of my patients who are suffering from chronic illness after I do an initial environmental screening. And I try to also make sure my patients understand that the work that I'm doing is based in literature, research. That's why we commend our researchers, because that gives us validity on which we can stand upon. So people leave my office with big packets of papers. They may not read them, but I also want to make sure they have that. I call it your arsenal. And things to know about the chronic inflammatory response syndrome or biotoxin illness is it doesn't have to be an active mold exposure. I had a patient of mine this weekend who told me, you know, we had a talk at our initial visit about potential mold toxins, and their first response was, I lived in a new house. And then today they told me, oh yeah, my new house had mold. Now, there are other things you can do. You want to make sure you remove the mold toxins, and there are certain treatments you go through, binders like cholestyramine and Welchol, which are published, or chlorella and agents like activated charcoal. Heavy metal toxicity is very common. You know, it's implicated in a lot of conditions, including Lyme disease. And those heavy metals can remain dormant until another infection or situation brings it to the foreground. The common heavy metals that I see cadmium, which has recent literature showing that cadmium toxicity is associated with breast cancer. I see mercury in a lot of my patients, arsenic. I've seen arsenic toxicity very common in my patient population. And you look at different sources. It can be seafood, contaminated water, metal amalgams, soil and dust, or pesticides. So I usually do 24-hour or some sort of urine heavy metal testing if I think that that's a potential environmental source of toxins. I need a little. Oh, there you go. All right. So, got to get the toxins out. So, like I said earlier, trying to make sure you do your best for digestive support, performing those food sensitivity panels if warranted, elimination diets, you know, herbals. We heard earlier about quite a few of the herbals that are used for detoxification, so I won't go over those in great detail. Ours did an excellent job there. And then stress reduction, mindfulness, you know, mood stability, having your adrenals evaluated, having relaxation techniques. You'll be surprised. I ask patients every day, what do you do for relaxation techniques? I would tell you, seriously, if I see 10 patients a day, 9 of them are going to stare at me blankly when I say, how do you relax? Even for 5 minutes a day, what are you doing to reset your cortisol response? And that's key. You know, those are simple, easy, cheap, dirty tricks to healing. Uh-oh. All right. And then another area of interest of mine are phospholipids, or essential fatty membranes. Phospholipids, hydrophilic one end, hydrophobic on the other end. And this is what surrounds every cell membrane in the body, all right? They're made up of phospholipid bilayers in the cell membrane. And you can have what's called lecithin, or phosphatidylcholine, which is a major phospholipid, and is used as an emulsifier in foods. It's also synthesized by the liver. So one of the goals in treatment is to make sure you're having optimal cell membrane support by optimizing phospholipid support. The literature has shown that the right omega-6 to 3 ratio that you want for optimal cell membrane support is about a 4-to-1 ratio. So I try to make sure that in my patient's diet that they have that 4-to-1 ratio with foods. There's also oils you can use, like it's a 4-to-1 balance oil made by Beyond Balance. You can also have what's called phosphatidylcholine. They have treatments orally and IV, and they help stabilize cell membranes. Chirunal oil, which is a long-chain fatty acid, very stable. It's a 3-to-1 ratio of EPA to DHEA. And then having high-dose omegas, which are our anti-inflammatories. But you really want to make sure that you're stabilizing cell membranes. And even in some of my patients may do fatty acid testing for cell membranes to make sure I'm adequately addressing those imbalances. All right, and I'm not going to do the laborious task of talking about all the different treatment protocols because I think we've heard that earlier. But you do want to make sure that you are treating the active infection by using the right protocol for whatever co-infection is dominant. In most of my patients, I do see Bartonella and Borrelia. Anti-helminths if needed, antifungals if needed, antivirals if needed. These are just our IDSA guidelines. You guys already know that. We went over that in great detail, the treatment, yada, 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 yada. And then as a member of the International Lyme-Associated Diseases Society, who's a group of multidisciplinary physicians who understand that chronic Lyme does exist. And we know that Lyme is epidemic around the world, and the tests aren't sensitive. But keep in mind, we talked a lot about testing. These diseases are clinical. And a lot of times, doctors, we forget to use our clinical acumen. A lot of times you can't base your treatment on test alone. And clinical means what you tell me as the patient subjectively and what objectively I find during my examination. So I stress that. All right, and those are just some of the symptoms of the different co-infections. Babesia, symptoms of air hunger, cough, sweats, daytime, nighttime sweats. Some patients have shaking, chills, headaches, migraine-like headaches. Bartonella, lymph node enlargement or lymphadenopathy. That striae that Dr. Savely showed us earlier, kind of looks like cat scratch. Red papular lesions and what's called subcutaneous nodules. Patients can report neuropathy, numbness, tingling, pains on the soles of your feet. Doc, I feel like I've been stepping on glass. Brain fog, cognitive impairment. Ehrlichia, muscle aches. A lot of patients I see with Ehrlichia have really high liver enzymes, fever, fatigue. Rocky Mountain spotted fever, rickettsia, you see sudden fever, rash, and joint pain. Mycoplasma, fatigue, musculoskeletal symptoms, and cognitive problems. And the one that's cut off is chlamydia pneumoniae, which you mentioned earlier, that you see quite a bit in Europe. And their symptoms do overlap. Fatigue, you have cough, joint pain. All right, so we went over the testing. I'm going to kind of skip through that. Just overall of treatment. Now, when it comes to the treatment of tick-borne illness, there is no clear guidelines regarding the duration of Lyme treatment. So even among the experts, the timelines may differ. You want to transition, in my opinion, to herbals or more holistic as soon as a person is clinically stable. But more importantly, you want to use your clinical judgment to carefully determine the patient's treatment protocol. I use combination antimicrobial, so I'll use combination antibiotics depending on what the predominant infectious organism is. And I also used evidence-based herbal treatment approaches as well. I use those, synergistically. I think in my patient population, that's where I've seen the most success. Everyone is different, and even among the experts, the treatments may differ. But like I said, it's based individually on a patient's needs. I have some patients who, for whatever reason, is it allergy or multiple chemical sensitivity or mast cell disorders, can't tolerate, antibiotics. Or I have some patients who may not be able to tolerate any form of antimicrobials, may that be antibiotics or even herbals, and you have to take a much gentler, slower approach. So everything is customized. And you also want to make sure when you're treating a person who has chronic tick-borne illness that you treat the biofilm form. And there are numerous ways. They have natural enzymes available, some that break up protein. They're called proteinolytic, nanokinase and serrapeptase are two. Some that break up fibrin, lumbrokinase or Baluch. There's been a publication on the utilization of lactoferrin and xylitol on the treatment of the biofilm of Pseudomonas. And I've seen that combination, lactoferrin, which has an enzyme, lactoferrampin, and it binds ferritin, and xylitol, the artificial sweetener, working synergistically in some of my patients are treating the biofilm form of Borrelia. And then Eva Shapi yesterday referenced some of her work looking at the artificial sweetener stevia and its effect on the biofilm. Looking at treatment of yeast as well, that's important. You know, some patients may need to be on a low yeast diet. And there are herbals that also treat yeast. There are formal antifungals that treat yeast. But most importantly, there are also probiotics like Saccharomyces, or just having good probiotics, because in general, Candida can crowd out the growth of that good microbiome. And I like to tell patients, yeast is a beast, because yeast, to me, when I'm chasing yeast, it's almost just as hard as chasing Lyme or other infectious organisms, because it is very resistant to therapy. It can become systemic, and it does mimic a lot of the symptoms of, you know, tick-borne illness. You also want to make sure you're addressing the viruses, because in an immunocompromised patient, even though they're exposed to viruses, one in particular, Epstein-Barr, that I see quite commonly, they can reactivate later. So sometimes you may have to put a patient on antiviral therapy due to their immunosuppressed state. So I always test for numerous viruses in patients. And then herbal strategies. You know, there are certain herbals, and once again, even though they're plant-based, you have to be cautious, because sometimes herbal management can cause significant Herxheimer's reactions. And you need to make sure, and that's why if you notice, most of these herbals that you get from companies like Research Nutritionals or Cowden Protocol or Beyond Balance, Byron Wright, you have to order them through a provider, and that's purposefully. Because a lot of times when you have herxing or toxic reactions and you start to feel worse, well, if you're not going through the treatment of a well-versed or a well-trained physician, you may not turn that corner and get better. And you need to be cautious, because sometimes even with the herbals, there can be contraindications with other meds. But these are just some of the common ones I prescribe in my practice. So Borrelia, Cemento, Banderol, Lyme Plus, Quina, Cumanda. Most of these are with the Nutramatic line, MCBB1 and BB2 through Beyond Balance. For Bartonella, BLT, I really like through Research Nutritionals, A-Bart. Hatunia, through Cowden, MC Bar 1 and MC Bar 2 through the Beyond Balance line, Cumanda and Lyme Plus. For Babesia, the symptoms with the sweats, headaches, air hunger, Crypto Plus is a great agent, anti-malarial through Research Nutritionals. ABAP is a great agent, artemisinin. Sita Acuta, Anula, and Mora, and then these three, MC BAB 1, 2, and 3, that I've incorporated from Beyond Balance. And then Beyond Balance has created a Morgellons protocol with the help of Dr. Savely, which in some patients I have found some benefits by the utilization of these agents, MC Bar 2, Toxis, Pronan, ENLTX, and Cyflocom 2. I alluded to the Herxheimer, feeling worse before you feel better. And I tell patients that's a sign that the treatment is working, yes, but you don't necessarily have to elicit a Herxheimer response in order for you to ascertain clinical gains. The goal in treatment isn't to torture you. I don't know how many people say, I'm having a Herx, I'm going to suffer through it, this is great. No, that just means you're toxic, and we're not doing the right thing in order to accommodate. Remember, we talked about the phase 1, phase 2 detoxification. We're not doing what we need to do to help support the exit of those cytokines that are causing you to have this adverse response. So cytokines exacerbate some of the Lyme symptoms. Neurological symptoms can be exacerbated, musculoskeletal symptoms. Psychiatric symptoms. I've seen patients with Lyme rage or worsening depression. I've seen patients become suicidal or very violent during herxing. But detoxification is important, I feel, before starting treatment, that you need to have some solid detox plan in place. It doesn't necessarily mean a formal one, but you need to have a way to treat as well as remove the dead organisms that are dying while you're going through treatment. So for my patients, I try to start treatment slowly. And I monitor patients very closely. All right, this is it. You're right on time. Warning. Do not treat any of these conditions without the support of a licensed healthcare provider. The risk of over-the-counter self-treatment can lead to dangerous outcomes. Adverse reactions can happen if it's not monitored closely. And make sure whatever provider you're using is incorporating an evidence-based approach in the treatment of Morgellons and tick-borne illness. And thank you. Those are my triplets.